Origin of radial nerve from the brachial plexus. Brachial plexus is formed by C5, C6, C7, C8 and T1 nerve roots from the spinal cord. C5 and C6 combine to form the upper trunk. C7 continues as the middle trunk. C8 and T1 combine to form the lower trunk of brachial plexus. The posterior division of all these three trunks combine to form the posterior cord of the brachial plexus, which continues as the radial nerve. This continuation of the radial nerve lies posterior to the third part of the axillary artery. The radial nerve lies anterior to the subscapularis muscle, latissimus dorsi and teres major and minor muscle in the upper part of the axilla. It enters the posterior compartment of the arm through the triangular space or triangular interval. The only branch given in this region by a radial nerve is the posterior cutaneous nerve of arm. This diagram shows the posterior compartment of the arm. As we already learned that the radial nerve enters the posterior compartment through the triangular space or the triangular interval. The boundaries of this triangle are lateral border of the long head of the triceps medially, lower border of teres major muscle superiorly, and the humerus laterally. In the posterior compartment of the arm, the nerve travels in the radial groove, where it gives motor supply to the long head, the lateral head which is shown cut here, and the medial head of the triceps muscle. Another motor branch is given to the Cutaneous muscle, which lies in the posterior aspect of elbow, somewhere here. Now the radial nerve is going to pierce the lateral intermuscular septum and comes anteriorly in the anterior compartment of arm, where it runs between the brachioradialis muscle and the brachialis muscle. In this region, it gives motor supply to the lateral half of the brachialis muscle and the brachioradialis muscle. Another motor branch is given to the extensor carpi radialis longus muscle, which helps in extension of the wrist joint. At the level of elbow, the radial nerve divides into a pure motor posterior intraosseous nerve branch and a superficial radial branch, which is the sensory branch. The superficial radial nerve travels in the anterior compartment of the forearm below the brachioradialis muscle and gives sensory supply to the hand by giving digital nerves to the thumb, index finger and the radial aspect of the middle finger. The posterior intraosseous nerve enters between the superficial and deep head of the supinator muscle and goes to the posterior compartment of the forearm. The posterior intraosseous nerve gives motor supply to the superficial and deep head of the supinator muscle and comes to the posterior compartment between these two heads of the supinator muscle. In the posterior compartment of forearm, it supplies the extensor digitorum communis, extensor indicis, extensor digiti minimi muscle, which helps in the extension of the fingers, and it supplies the abductor pollicis longus, extensor pollicis brevis and extensor pollicis longus tendons, which help in extension and abduction of the thumb. Radial nerve also gives sensory supply to the upper limb in these areas. The posterior cutaneous nerve of arm, which gives sensory supply to the posterior aspect of arm. Another branch called lateral cutaneous branch of arm gives sensory supply to the lateral aspect of the arm. Posterior cutaneous nerve of forearm gives sensory supply to the posterior aspect of forearm, and the superficial radial nerve gives sensory supply to the hand through the digital branches.